everybody. Hope you all are doing really well. Welcome to our another discussion video, and today we are going to discuss about the case history. I know this is an easy topic and it do not require much of your attention, but trust me, easy things become really difficult when you have to explain for the obvious things. When the obvious things demand explanation, justification, it happens obviously during the viva that we start peeping towards the wall or into the window, that how could I escape or how could I even explain so obvious and easy things. So without any further delay, let's get started. And first of all, I would like to define that what is the case history. How can you define the case history? See, case history is a planned professional conversation which enables the patient to communicate his or her fears to the clinician. And whatever the patient is going to say, we have to record those problems in the patient's own words, and in order to find that what is the suffering the patient is experiencing, and we have to make out the proper diagnosis. Now, first thing is, why am I calling this case history as a planned professional conversation? It is said to be the professional one because depending upon the words, the non-medical terms, the feelings of somebody, we have to translate the feelings of some person into the proper diagnosis to provide a perfect treatment to the patient. That is why while writing the definition or while telling anybody, you must tell that it is a professional conversation, because we have to listen to the patient and we have to carry out that, we have to translate that data, translate that information into the medical pathologies that we study. And this art, if you are good at this art, the more good you are, the better doctor you will be, right? A detailed and concise compilation of all physical, dental, mental, social. You know what? Previously, what we used to study whenever, like years back, whenever we used to study about any perspective, we actually involve only the physical and the mental well-being. A time came when we have started involving the social involvement, the social environment in the personality development, in the entire human development. Whenever we study about the development of anything in humans or in any area, we actually focus the role of social life over there as well. So now also, when we call that, how can you define somebody who is healthy, then we say the person should feel, so the person should not be just free of diseases. The person should be physically, mentally, socially, emotionally, at each and every perspective. The person should be healthy. Then only we can call him as a healthy person, right? So actually we have to be, actually doctors needs to be fake. It happened, I always used to think, why doctors are so polite? How could be they so polite to somebody? How can they actually hide their emotions, and they have to understand what all things are going, what all experiences is there in the patient, right? So actually it is all about the planned professional conversation. Now the first parameter, and why are we doing all these things? Why do we require that patience? Why do we require this case history? So that we can actually go for the perfect diagnosis, for the satisfactory treatment to the patient who came to us with a belief that we can do something for the things he is suffering from, right? Now, before moving on to so many difficult things that we actually fill with such an ease in the case history, let us talk about few simple things in today's discussion. First thing comes is the name of the patient. See, it is very simple to write the name of the patient, but when it comes to the significance, that why am I asking the name of the patient, the first thing that you should write is For the record maintenance, we have to maintain the record of the patient, that this was the patient who came to us, and for the ease of recording the data. Simultaneously, it is for the psychological relation with the patient, right? If I will be called by somebody who know my name, that I may be more familiar to the person rather than the person who is stranger to me, who don't know even my name. I won't be comfortable with that person, but I would like to entertain the person who is in front. I would like to talk to the person, and I would like to be open to the person, that what all feelings are there, only if my name is known. So name is some sort of a psychological attraction, some sort of, like in pediatric patients, we often ask that what is your name, what is your pet name. Why do we ask all these things? This is for the psychological interaction to the patient, that the person should feel comfortable and should be able to explain the actual feelings, the actual problems they are suffering from. They should not try to hide anything from us, right? In pediatric patients, I really feel like, oh my god, it's a time when you should have a best of cooperation, best of patience, best of politeness. I actually do. Hats off to all the pediatricians. I mean, you people are really doing a good job. You really require so much of patience within you. But this is something that we have to be in, that why we ask the name of the patient. Simultaneously, what happens when you talk, when this psychological interaction is there, the patient is somewhat reliable. The patient feels somewhere confident that, okay, fine, I can trust this person, because then we can add much more promises that we are supposed to do, and we work on those promises. It's a sort of a convenience method. We are going to convince our patient in a better way. Moving ahead, we have seen that we ask to the age of the patient. That why do we need to know the age of the patient? See, it is very important to know the age of the patient, because some pathologies are really common in some particular ages, right? For example, if a patient comes to me and that child is not having any tooth in the oral cavity, no such tooth in the oral cavity, then I can think that there may be present some hereditary ectodermal dysplasia, right? Rather than the thinking that the person may often have this shedding of teeth because of aging. We have always remember, when we study about any tissue, we also study in the end about the aging process, right? So age actually pays much attention to this case history. You should know the age of the patient. For even the drug doses, we are going to study about the rules as well. Now, the next thing is, suppose there is some sort of delayed eruption. Now, what happens in case of ankylosed teeth? Now, what used to happen, if you break this word now, ankylosed, then ankyl is a word which defines adhesion, right? Which means something united. In some people, what happened, in some patients, what happened, the deciduous tooth is supposed to have the root resorption criteria, but actually what happens in them, due to absence of the periodontal space, I hope you know the periodontal space, the periodontal space is not there. So what happens, there is unite or union of the alveolar bone and the root of the tooth. Because of that, the resorption process is affected and the deciduous tooth fail to move out of the oral cavity. Now, what is the disadvantage? It is somewhere inhibiting the eruption of the permanent tooth. So what happens, suppose a patient is coming to me and they are telling me that the tooth hasn't erupted yet. So what we are going to do, we are going to go for the radiograph. We are going to find it out whether the permanent tooth bud is present over there and what is actually the thing which is there. We have to deal with, right? So age specificity is really important criteria we have to consider. After this, what happens even in the behavior management? If you talk about the behavior management, when you have to deal with a child patient, you have to be quite good. You have to be, I must tell you, have to be really good, because at that time, for the treatment, for the entire procedure, we need the cooperation of child as well as patient. So at that time, we have 1:2 ratio relationship. In case of adult patient, we need the cooperation, we need the understanding of that adult patient only. So the ratio also changes with the age, that what is the convince criteria, what are the factors that we have to include. In child patient, we have to consider only, in child patient we have to consider the parent as well as the child. We have to be good at the convince level, we have to be really good to manage both of them. So the ratio over there is 1:2. Whereas in adult, we have to just convince the person in front, the adult in front, to please be ready and be cooperative. So along with that, we have the child dose. We have 3 formulas which are written over here. We have Young's rule, we have Clark rule, and we have Dialing rule. I am going to mention the formula of each and everything so that you can pen down and please even learn them. They really are of greater significance, because it happens that sometimes you are asked to calculate the child dose. After this, let's talk about the gender of the patient, right? Why am I supposed to mention the gender of the patient? Okay, so gender of the patient is like, I can see the female is there, I can see the male is there. Why I need to specify? Because again, the same thing comes, that few diseases are more common in females and few are more common in males. Now let me tell you one important thing as well, that during my Viva time, I actually understood that few diseases are more common in males and few are more common in females. But trust me, during my Viva time, I was asked that mention at least 8 to 10 names of the pathologies which are more common in females and which are more common in males, and I was like, I didn't learn them because I wasn't even thinking that they will be ever asked to. So what happened, for you, for the ease, for all those who really want that if this question comes to you, so you should be able to answer, what I did, I manipulated and I tried. I will be giving you the table, right? I will be attaching the table even at the end of the discussion, but simultaneously what actually I did, for the females and for the males, I wrote the alphabet of each and every pathology. Like you can see, it's A, C, 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 D, I, J, M, M, N. So actually I wrote, because I can learn the name of the pathologies, but I actually failed to mark them specifically during my Viva time in front of the external. So what I did, I wrote this thing for 2 to 3 times in a day and I actually learned the pathology over there. Let me tell you what all these things are so that you can also try this method and you can also learn few of the pathologies, at least the name of few of the pathologies which are common in females and which are common in males. So let me show you first. There is nothing else written on this sheet and I'm not going to see anywhere. I'll try that I will not see anywhere. First I have written A. For the females, which all pathologies are common in females, you can write adenoameloblastoma, you can write about the caries. Another C you can see over here. This is for the adenoameloblastoma. This is for your cicatricial pemphigoid. Then you can write about the caries. Then you can write about central giant cell granuloma. You have central cementifying fibroma. D is for the diseases of thyroid. I is for the iron deficiency anemia. Another I is for your idiopathic thrombocytopenic purpura. J is for your juvenile periodontitis. M is for your malignant melanoma. M is for your myasthenia gravis. N is for your nasoalveolar cyst. Then we have P. P is for your pleomorphic adenoma. Then you have peripheral giant cell granuloma. Then you have peripheral cementifying dysplasia, or you can write peripheral cemental dysplasia. Then you have peripheral ossifying fibroma, right? After this you have S is for your sickle cell anemia and you have Jorgen's syndrome. T is for your torus palatinus and R is for your recurrent aphthous stomatitis. This is the method of learning the pathologies which are common in females, and trust me, you should do this thing so that when you study about each and every pathology in detail, the first thing that you can mention is that these all pathologies are more common in females, right? After this, let's come to the males. This is the alphabet that I wrote for the males. The first is A. A is for the attrition. Then another A. I am going to write this thing at the end. Don't even worry. It will be displayed in the video only. First A is for the adhesion, then you have adenolymphoma, then you have ameloblastoma, fibroadenoma, then you have adenoid cystic squamous cell carcinoma, then you have benign osteoblastoma, then you have basal cell carcinoma and basal cell adenoma. Then C is for your, let me turn towards my side, then C is for your caries in the deciduous dentition, then you have carcinoma in situ, then you have carcinoma of buccal mucosa, then you have another C for the chondrosarcoma, we have E for the Irving's sarcoma, we have H for the herpes simplex, we have another H for the Hodgkin's disease, we have K for the keratoacanthoma, we have L for the liposarcoma, we have another L for the leukoplakia, we have M is for your multiple myeloma, N is for your North American blastomycosis, then O is actually for your osteoid fibroma, then P is actually for your pernicious anemia, R is for your Retter's syndrome, S is actually for your solitary plasma cell myeloma, and V is for your verrucous carcinoma, and W is for your Wegener's granulomatosis. So actually this is the criteria that you can learn and you can write anywhere about these alphabets, and you can learn that which all pathologies are more common in females and which are more common in males. Now along with this, in case of females, whenever we are going to give any drug, we should take one thing in consideration, that the person or the female is at what stage. Is there menstruation going on, or any pregnancy or any lactation period the female is at, right? So all these parameters are really important to be considered. Now in case of males, what do we require? In case of males, when we give antihypertensive drugs, when we mention to them, then most of the cases it was found that they affect the sexual activity. The most frequent thing that I have heard about the ketoconazole, the most frequent side effect that I have heard about the ketoconazole is the loss of libido, the loss of sexual desires in males. So actually this happens to be considered whenever we are taking any person in treatment. That is why gender is an important criteria to be felt. Right, after this we have to manage the dose as well. See, it's not that in case of child and in case of adult you have to consider the dose. You have to mention the dose, because as compared to female, male have more body weight, right? Please don't consider me. When I look myself into the mirror, I really feel that I should not say anything. So actually we have to consider so many parameters, right? After this, moreover, females are more concerned when they go for the treatment. Specifically for the teeth one, they are more focused on the aesthetics. They really focus that there should be good aesthetics, and males are more considered for the comfortable nature, that the treatment should provide them the comfort level should be really good. So these are the basic reasons that we have to consider the gender of the patient. After this, let's talk about the address of the patient. Nobody is going to call me at their residence to have a cup of coffee with their parents and their family members, and if so, even I'm not allowed. Okay, so after this, address. Why we need to ask the address? It's actually because when a patient comes to you, you should really know that are there any activities or are there any pathologies which are more common, as you have seen in case of our field. Maximum time when patient comes now, I have seen mottled enamel, I have seen the dental fluorosis in them. In the domestic water, there is excessive amount of fluoride which is coming over there, which causes the spotting on the enamel. You can see the brown discolorations and the white colorations onto the tooth surface. So actually these things happen over there, and we have to consider them as well, because this is somewhere helping us to know. That is why we really want the address of the patient, in order to know the geographical, in order to know the environment in which their oral structures, in which their all other body structures are exposed to. Right, now let me tell you, in India, the cancer of lip is very rare, whereas the cancer of tongue and buccal mucosa are very common. Right, now what else? Periodontal diseases are more common in case of rural areas as compared to the urban one. Another point that I want to tell you, I don't know much about this. There is a tobacco, chutta, in Tamil Nadu, and in Bihar you have gutka. I have heard about gutka. I never had it, but at least, and if you are having, then please stop having it. These are the form of tobaccos which are not good for your teeth. You will not have any good smile after having chutta, gutka, or even there is one in Hukli in Bhavnagar of Gujarat, and you have buzzer in. Buzzard is a kind of a snuff which is used by the women in Gujarat. I don't want to comment much on it, but it is written in the book that these are some tobacco forms which are very oftenly used in these particular states, and we consider them because when we are going for any such survey and we are finding more things, more the geographical location is affecting climate, vegetation, all these things really take a very important role in the entire human development, and slowly we consider them. Like we say that the people who live in the colder climate, they are having a lighter complexion as compared to those. See, I'm not commenting on it because I have seen people saying over here, right? We will be discussing about this complexion part later on in some later videos with a good evidence and proper explanation if it is existing. So after this we have now what happens, there are some diseases which were more common, as they found the leprosy more common in West Bengal. Moreover, they found the peptic ulcers are more common in northwestern and southern part of India, right? In South Africa, it was found that sleeping sickness was more common. In Kashmir, they found a Kangri cancer. Kangri cancer was found to be more prominent in Kashmir, and in urban areas they say the obesity. I am one of the example. Obesity and arthrosclerosis are more common, and in the rural areas malnourishment and anemia are more common things that we really find. Right, so these are the things that will help us to reach to the perfect diagnosis when we are dealing with any patient, and that is why we ask the patient about the address. Next thing comes for the registration number. We also fill the registration number over there. We have to fill the registration number for the data that we are having this patient and all regarded information is there. It's actually for the data, right? Occupation is very importantly asked. I wasn't aware that why people ask me that what is the profession of your father, what is your father a service one or a business one. I wasn't like, why are they asking me, what they want me to tell to them that we are living here or there. Why are you asking? Actually, the occupation, first thing, we will be helping the doctor, we will be helping the clinician to make out that what is the financial status of the patient, what kind of treatment they can afford. For example, in some patients we go for the extraction, right? In some patient we tell that RCT could be done. In some patient, see, optionally we say if it can be done, then only we mention. It is not like that we just tell them that this can be done, so let's go. Not like that. So depending upon the financial status of the patient, what the patient can actually afford, we answer that this could be the probable treatment you can go for the economic ease of the patient, so that patient can actually get the treatment as well as within the limits they can follow up, right? After this, again, you can see that some diseases are more common in some occupation as well. Now I'll tell you. For example, those who are more exposed to lead or cadmium or bismuth type of things, they are having the gingival staining, right? I don't want to show you right now. Gingival staining is more common in them, right? Now, in those who are having a chronic exposure to sun, to wind, to dust, they are more prone to have the cheilitis glandularis. I am going to attach each and every image, don't worry. You will be able to appreciate that what words am I talking about. Then you have seen that those in the bus conductors or in the traffic policemen, you have seen varicose veins more common in them. So there is actually all those workers who work in the chimney, sweepers or in the oil companies, they are more prone to the cancer of scrotum. Even I think I read one point, urinary bladder neoplasm is really common in the aniline dye exposing workers. So actually all these things are really common depending upon the profession. Moreover, you have seen the attrition in males. There are some happens. Let me give you a very simple example of a carpenter. They used to, while doing that knockout thing, they used to keep the pin in their mouth between the teeth, so that can damage the teeth. They don't even know that what they are doing, but actually that can damage the teeth. In attrition, we have seen the first thing when we look onto the patient, now we ask, what are you doing, what are your habits, and another thing, what is your profession. So this is the something, an important criteria that we mentioned when we study about the occupation part, that why we need to ask the occupation of the patient. It is of greater significance. First thing, for the socio-economic ease, that for the economic part, whether the person will be able to go for the treatment or not. And another thing, that is the pathology which is there in the person is because of the things he or she is exposed to for a longer duration. After this, see, time is also very important, right? We know that if suppose a child patient is there and both the parents are working, right, and they are not coming up for the regular things, we have to consider even that part also. Another thing is religion. See, I don't want to comment much on the religion because all those things which are written in the book, I am not having any good knowledge of the religion part, that what happens to be there, and it is related to the religious belief. So I don't want to disrespect any belief. With due respect, let me make it out. And you have seen there is a carcinoma of penis. It is hardly seen in the Jews and Muslims owing to their religious custom of compulsory circumcisions of penis. So you can see the carcinoma of penis is hardly seen in them. It is because of the religious belief they follow. We have another thing, that is the phimosis. Phimosis is also less common when it comes to the Muslims and Jews because of again the religious belief they follow up. And you have intussusception. Intussusception is sometimes seen after a month-long fast in Ramzan in Muslims. You have seen that they do the fasting process for complete 1 month, and their I think eating habits are somewhere restricted between some time. I'm not having a good knowledge about it, so I don't want to comment anything. It's just that these things are found to be more common. And let me tell you, intussusception, I read over there that intussusception was said to be a part of intestine telescope into itself. You can see some sort of intussusception, that is telescoping of the small intestine is there, right? And trust me, it's a life-threatening situation for them. Phimosis is actually, if you want me to define that, what is phimosis? Phimosis is the tight foreskin can't be pulled back over the head of the penis. So this is said to be your phimosis. So actually what happened when we are dealing with the Muslim patient or when we are dealing with the Jews, because of their cultural beliefs, we can see the carcinoma of penis, the phimosis, and intussusception. Slightly like intussusception is slightly more and rest two things are slightly less. So with this we end up that what are the things that we basically ask in the case history part, and why do we need to ask them. Now I think in the Viva you will be able to appreciate about these small things. See, easy things which are obvious things which are, but they require your attention. Now in the next part we are going to record the chief complaint, that when a patient is coming to you as far as dentistry is concerned, what are the chief complaints that could be there, and depending upon the chief complaints, what should be the first thing, the first pathology that should strike your mind. So in the next one we are going to record about the case history of the patient, that what could be the probable chief complaints, and what, you know what, let me tell you, it is really important because once I was doing the OPD and my HOD sir, he came to me and he asked me that what are the 7 parameters of pain that you are going to consider in the patient. And I was quite stuck that are yaar, wo to I didn't read, because that was not of much importance. We have to merely decide, but we should be really good at the explanation part. So with this we end up our discussion and hope you may like these discussions. We really entertain if you are going to take part in these discussions. If you have anything new to tell regarding anything regarding the religion part that we have discussed, or regarding anything in the case history that we have mentioned at the points where I may be wrong and you really want to clarify, we really welcome all these suggestions, and hope you may help us, hope you may support us in future as well. Thanks a lot and have a nice day.